Hello, welcome to Microlearning, Module 4, Overview of Medications for Heart Failure. My name is Carrie Reynolds, and we are thrilled to have Tracia Oshana guiding us through this particular module.
Okay, with heart failure, our first choice for a diuretic are the loop diuretics, and specifically our prototype is furosemide, also known as Lasix. Furosemide works by blocking electrolytes, sodium, potassium, and chloride, and water from remaining in the vascular space, and so it then puts these electrolytes and the water into the loop of Henle. And by doing that, what we're doing is we're pulling those electrolytes and water from the client. We're making them increase their urine output. So if we're doing that, that easily can help us to understand what are some key side effects to these loop diuretics. So the side effects are hypokalemia and hyponatremia. And because we're pulling that fluid off, we potentially could lower the blood pressure and cause hypotension and dehydration. Also, loop diuretics are toxic can have that ringing in their ears. And it also can be nephrotoxic. So it's really important that we monitor the appropriate renal labs, the BUN, creatinine, and GFR. So before administering loop diuretics, because of these concerning side effects, it's really important to assess their electrolytes, specifically potassium and that sodium. Because we're pulling that fluid off and potentially causing hypotension, check that blood pressure, and we can cause that dehydration, so that intake and output balance is important to assess. And again, that renal function and making that it is appropriate. Another drug that we use in heart failure are the cardiac glycoside digoxin. So here we're inhibiting the sodium and potassium pump, and we're increasing intracellular calcium levels. So if we're increasing calcium, we're enhancing that cardiac contraction, so that inotropic effect. So that heart has that great ability to pump blood more efficiently. So therefore, we're increasing that stroke volume, so the amount of blood that goes out with each contraction, and then therefore, over a minute, we're increasing that cardiac output. But at the same time, we're controlling and trying to slow it down. So having said that, before giving digoxin, real important NCLEX point, listen to the apical pulse for a full minute. Really important, because in an adult, if the pulse is below 60, you have to hold and call a provider. And in a child, it's below 70, and in an infant, below 90. Digoxin has a very narrow therapeutic level, 0.8 to 2.0. So it's important to know what that level is prior to giving digoxin. And because it has that narrow therapeutic level, the risk of toxicity is extremely high. So it's important to know those signs and symptoms. The first signs and symptoms are GI, anorexia, and nausea. And then it can progress to real serious signs like vision changes, yellow and green halos, and confusion. Other things that can really potentially increase the risk for toxicity are low potassium levels and renal insufficiency. So monitoring the potassium levels and the BUN, creatinine, and GFR. So if you have a client that is on digoxin and a loop diuretic and that risk of hypokalemia, a greater chance of digoxin toxicity. So really important to continue that assessment. And we want to avoid aminoglycosides because of that increase of nephrotoxicity. Thank you.